Hi, this is Nurse Tina again. Today I want to educate you on issues regarding acid reflux and heartburn. When you swallow food, the food goes in a tube called the esophagus. It will travel down the body and pass through a sheet of muscle called the diaphragm. It will then enter the stomach for digestion. Here are some statistics about heartburn. More than 60 million American adults experience heartburn at least once a month, and more than 15 million adults suffer daily from heartburn. At the bottom of the esophagus there is a round muscle that acts like a valve. When you swallow, it relaxes and allows the food to pass into the stomach. Proton pumps in stomach release acid to help digest the food. Lining of stomach protects from acid. The diaphragm pinches, closing of opening the stomach. Closing. Normally a small amount of acid flows back into the esophagus in a process called reflux. But what happens when the excess acid flows back into the esophagus? Why and how does this happen? After many years of acid flowing back into the esophagus, there can be a lot of damage to the esophagus. One reason this occurs is the valve becomes weaker and doesn't close tightly. Acid and partially digested food comes up back into esophagus. Another reason is that the diaphragm weakens around the esophagus and the hole called the hiatus becomes larger. Part of the stomach will bulge through it and the stomach and the valve move up, disengaging the diaphragm. Acid will get into the esophagus. Repeated splashing of acid into the esophagus causes GERD, or Gastroesophageal Reflux Disease. Here are a variety of factors that can weaken your esophageal sphincter, including overeating, being overweight, pregnancy, smoking or regular exposure to secondhand smoke, hiatal hernia, which is when part of the stomach protrudes into the diaphragm muscle. Foods to avoid include alcohol, chocolate, citrus, fried or fatty food, carbonate beverages. By avoiding these foods, you will effectively lower chances of acid. But how do doctors detect heartburn and acid reflux? Usually, X-rays are taken to view the shape and condition of your esophagus and stomach. Endoscopy is done to check for abnormalities in your esophagus, usually through a tissue sample. Esophageal motility testing is done to measure movement and pressure in your esophagus. What are usual treatments for this condition? Antacids, which help neutralize stomach acid. Antacids may provide quick relief, but they can't heal an esophagus damaged by stomach acid. H2 receptor antagonists, H2-RAS, which can reduce stomach acid. H2-RAS don't act as quickly as antacids, but may provide longer relief. Proton pump inhibitors, such as lansoprazole, Prevacid 24HR, and omeprazole, Nexium 24HR, Prilosec OTC, which also can reduce stomach acid. But what can we do to stop these medicines and still end heartburn and acid reflux? Do you want a holistic approach and a guide to prevent this condition because it impedes your life?